Good afternoon. Thank you for joining our webinar and giving us an opportunity to share with you the Housing for a Healthy California program. This is our draft guideline. My name is Stephanie Tran Hongbele, and I'm here with my team.
Abby Crowther.
Lisette Heiser.
Imaiz Wahid.
Okay, so we are going to get started right away. So some background on the program. AB 74 was signed into statute as part of the housing package in September 2017. Basically, this program authorized us to create supportive housing opportunities for individuals who are recipients or eligible for health care services provided by the California Department of Healthcare Service Medical. And the goal of this program is to reduce the financial burden of local and state resources due to overutilization of emergency department, inpatient care, nursing homes, as the point of health care provisions for people who are chronically homeless or homeless and a high-cost health user. So statute does not define high-cost health user. We went ahead and defined it as a person who are shuffling around homelessness or have had at least 3 emergency care or 1 inpatient stay within the past year. Moving forward to the timeline, as you guys know, we've released the draft guidelines on November 8th. Public comment period will end December 8th. We encourage you to go ahead and send us your comments and feedback and recommendations to our email address, which is provided at the end of this slide. Both the guidelines and the webinar PowerPoint presentation are posted on our website for future reference. And we are anticipating and finalizing the final guideline after public comments by January 1st, 2019, and then we anticipate to release a notice of funding availability around springtime in 2019. So the HHC Program Overview, just as a disclaimer, if you were looking at the original statute, it does not follow the guidelines because the sponsor are currently moving forward and obtaining language and text change to the bill. So as of right now, we are writing the guidelines to provide more flexibility. As you may know, AB 74 or the HHC programs, we have 2 different funding streams. The first one is utilizing the Federal National Housing Trust Fund, and so what we've done is we've broken the guidelines into 2 different articles. Article 1 follows the federal regulations, and both of them are competitive to, actually, Article 1 is competitive to developer for capital loans and operating. And then Article 2, we will be using a one-time portion of the SB2 funding, and that will be for counties for acquisition, new construction, reconstruction, rehab, admin costs, or the capitalized operating subsidy reserve, which we are calling it COSR, as well as rental subsidies and rental assistance. So I'm going to go ahead and pass it to Abby to go ahead and discuss Article 1.
Okay, so like Stephanie said, Article 1 is funded by the National Housing Trust Fund, and we'll jump right into the minimum requirements. The first is we have to look at who is an eligible applicant, and it is an owner or developer, and the way that is defined is it can be any organization, agency, or other entity, including a public housing agency, a for-profit or nonprofit that's acting in the capacity of owner-developer. So this can include a county. And then the applicant must have no members of the development team currently federally debarred or suspended. The second minimum requirement is financial feasibility. So your project must meet the requirements of the guidelines listed here on the PowerPoint slide. And then it must also prove fiscal integrity, which simply states that your operating income and operating reserves at any one time must be sufficient enough to cover your operating expenses and current debts. The next minimum requirement is experience of the project team, and our PowerPoint and the guidelines spell that out with 3 different roles. We have the applicant, owner, developer. Second, we have the lead service provider, also known as the LSP. And then third, we have the property manager. Our PowerPoint has a table which describes the minimum requirements and experience for each of these roles, both in years and number of projects. And your experience must be documented through contracts with public agencies, housing owners, or foundations, as long as they served at least 10 households at any one time. The next minimum requirement is site control, which must be in the name of the applicant or an entity controlled by the applicant, and must meet the requirements of the UMR listed here and in the guidelines. You can demonstrate ownership interest with any of the following documents. Some examples of those are a fee title, a leasehold interest, or an enforceable option to purchase. The next minimum requirement is integration, which is an important component of the program. You'll need to make sure that your project physically integrates the assisted units with other units. For example, you cannot have one floor with only assisted units and the next floor non-assisted units. They must be integrated. And then for projects greater than 20 units, the department will fund no more than 49% of those units, and that's in order to promote integration. Applicants must certify that they'll facilitate and provide regular community building activities and design their project in such a way that it promotes tenant interactions. And then the supportive service plan and property management plan must also show how you're going to promote integration. The next minimum requirement is Article 34, which requires voter approval before you begin your project. If you're interested in having a project that includes scattered site housing, be sure to reference the guidelines. In a nutshell, all project sites must be under the same owner. They must also be under one set of program documents, one operating reserve, one audit, things of that nature. The next minimum requirement is environmental conditions. Your project must be free from severe adverse environmental conditions like toxic waste that cannot be mitigated. You can refer to the Code of Federal Regulations for some more details on that. And then your project must also meet state and local requirements, such as being on a permanent foundation and meeting state and local code when it comes to things like minimum square footage and making sure that the unit is habitable. The next minimum requirement is amenities. For this program in particular, all project sites must have reasonable accessibility to public transit, public schools, public parks, and other recreational facilities. And it must also be within reasonable proximity to employment opportunities for the tenants. And then lastly, you must also give consideration to to when these services are open and available to tenants, the travel time, and cost to and from. When it comes to stacking unit-based subsidies, if you just be aware that multiple HCD funding sources cannot be stacked on a single assisted unit. You can use other program funding like the IIG and the HHC, which are infrastructure programs. And if you plan on using another HCD funding source on the same project, you just need to ensure that it's supporting other units besides the assisted units for this program. The next minimum requirement has to do with relocation. So if your project results in the displacement of tenants, just be aware that they may be entitled to relocation benefits as discussed in the Code of Federal Regulations. And then any relocation plan needs to be reviewed and approved by our department prior to construction. You must also comply with 2 CFR Part 200, which is an administrative procedures code. And then if the applicant is a local government applicant, you must be compliant with your housing element and your annual progress report submittal. When it comes to the actual application that you'll be submitting, it must be on forms made available by our department. You must also include a resolution from your governing board to apply for the funds, and the amount you request must not exceed the amount authorized. You must also submit a memorandum of understanding or commitment letter from the LSP or county making available the case management services, and there's a few examples listed here in the guidelines. You must also certify that the residents in your project can own a household pet pursuant to the Pet-Friendly Housing Act of 2017. And then you're going to provide a supportive services plan showing how you're going to meet the needs of the target population. And then lastly, in the application, you're going to submit a property management plan that utilizes a low-barrier tenant selection process, accepts referrals for those with the highest needs, implements housing first practices, implements policies to help prevent evictions and facilitate reasonable accommodations, and then lastly, implements policies that comply with the Violence Against Women Act. And then we're going to see if there's any questions at this time before we proceed.
So the first question is, where can I access these slides? So the slides, as I mentioned previously, are posted on our website. The recording, the webinar recording, we will try to post it up by the end of this week, but maybe due to the holiday, we might have to post it on next week. And the next question is there a requirement for projects to use the local coordinated entry system for tenant selection?
There is a requirement to use a coordinated entry system or a similar system if you have one, and that ties back into the housing first requirement as well, which we'll get into in a little while.
Okay, so we're going to go ahead and move forward to the next section.
So the next section is, again, for Article 1. We're going to discuss the eligible uses. Again, this is geared towards owners and developers. So the first eligible use is acquisition and or new construction. Just be aware that if you're going to be demolishing an old building or project, the number of bedrooms in the new project must be at least equal to the total number of bedrooms demolished. And then the assistance for this loan is a post-construction permanent loan with an initial term of 55 years. The next eligible use is that called the Capitalized Operating Subsidy Reserve. Because we're providing affordable housing to low and no income units, your project may be likely to experience an operating deficit. So this portion of the award is mainly used to help with that operating deficit. And we'll dive into that in more detail shortly. There are maximum per unit loan amounts as prescribed by HUD. And if we go to the next slide, we'll show you what the capital portion base amount starts off at. It starts off at $125,000 per assisted unit for projects using 9% tax credit, and then $175,000 per assisted unit for all other projects. And these amounts are adjusted annually with the Consumer Price Index. And then there's also adjustments for the COSR portion of the loan. And Amaze will discuss in more detail shortly some of the factors that go into calculating that portion. There are property standards that you must meet, both federal and state property standards, and those are listed in the Code of Federal Regulations. And you must do so for 55 years. An exception to this is if you have a project on an Indian reservation or Native American land, in which case it's 50 years. For the loan terms for Article 1, it bears a simple interest rate of 3% on the unpaid principal balance and starts accruing from the date that funds are dispersed. For the first 30 years, there's an annual monitoring fee of 0.42% payable to our department. And then after 30 years, our department might reset the required payment amount to cover our monitoring costs. Except for the required monitoring fee, if the borrower is not in default, the department shall permit the deferral of accrued interest for the term of the loan. There are both occupancy and income requirements for Article 1. We'll get into household income shortly, but occupancy requirements are for the full term of the regulatory period, so 55 years. When it comes to determining if a tenant is income eligible, some of the documentation listed on this slide can be used. So you want to document their enrollment in or eligibility for Medi-Cal. If they are chronically homeless, you can capture that with any of the examples listed here. And again, these are in the guidelines. And then if they are considered a high-cost health user, you can capture that with any of the examples listed here as well. When it comes to rent limits, they are published each year by HUD, so it depends on geographic area and bedroom size, but there are rent limits. And at the time of intake, the tenant's income needs to be determined and then re-examined each year. If at a recertification time a tenant is over income, they can still reside in the assisted unit. It's considered a temporary non-compliance issue. So you'll just have to make sure you cure that the next time you have a comparable vacancy to make sure that your mix is appropriate of assisted units to non-assisted. There's a section in the guidelines for underwriting standards. For the sake of time, I won't go into each UMR and each section of the California Constitution, but all of these are listed in the guidelines as well as on this PowerPoint. If there's a difference between the provisions of the UMRs and the guidelines, the provisions of the guidelines will prevail. And then when it comes to establishing the COSR amount, there is an assumed vacancy rate of 10%. But again, Amaze will dive into that section in just a moment and give some more clarification on that. Are there any questions at this time? We're going to take a look. So maybe we'll give it just a moment, and then I'll hand it over to Amaze, who will discuss both the COSR and health criteria.
So we're going to go ahead and move to the next section because there's no questions.
Okay, thank you, Abigail. Good afternoon. My name is Amaze Wahid, and I will be going over sections 108, 109, 110, and 111 of Article 1. So section 108 of the guidelines is capitalized operating subsidy reserves. When talking about the uses of the NHTF funds in section 103, Abigail mentioned that one of the things that NHTF funds can be used for is the capital operation of the assisted unit. Section 108 provides information necessary to understand the COSR portion of the loan, which I will go over. So again, the NHTF funds can be used to pay for the COSR to cover anticipated operating deficit related to the assisted units, provided the following conditions are met. The first one is that whatever amount is determined, maximum per unit loan amount is determined pursuant to section 103, Part B. A project cannot exceed that loan amount to address any operating deficit related to the assisted unit. And the second condition is that determining the size of the COSR. The size of the COSR should be large enough to cover any anticipated operating deficit related to the assisted units for a minimum of 15 years. The third condition is determining the factor, what factors the department will take into consideration to determine the size of the COSR. the department will take the following 5 factors into consideration. The first one is maximum percentage of assisted units the COSR will assist, anticipated vacancy rate of a project, anticipated percentage of assisted units that will have other operating or rental subsidy, as well as the terms of that operating or rental subsidy. And the last one is anticipated tenant incomes of the tenant that will occupy the assisted unit. In addition to that, the department will take the following standard assumptions into consideration for the purpose of establishing the total amount of project COSR. As you can see on the slide, and as well as it's mentioned in the guidelines, there are 5 standard assumptions that the department will take into consideration to establish the total amount of a project's COSR. One thing I would like to highlight from this slide is that the stabilized residential vacancy rate for the assisted units, the department will assume that to be at 10%, unless the use of a lower or higher rate is required by another funding source, such as TCAC. And then, as I mentioned, projects COSR must have enough funds to cover anticipated operating deficits for a minimum of 15 years in order to sustain the availability of the operating reserves for a minimum of 15 years. What the department will do is the department will not disperse more than 5% of the total COSR to a project per year, unless if it is determined that in any given year, if the operating deficit related to the assisted unit exceeds the projected amount, then the department will increase the disbursement to up to 7% of the total COSR. And the last thing that I would like to point out regarding the COSR for Article 1 is that the COSR can be used to pay for the following 5 operating expenses. They are insurance, utilities, real property taxes, maintenance, and any scheduled payments to a reserve account for replacement of major systems. Section 109 of Article 1 is award limits. 3 things that I would like to point out regarding Section 109. The first one is that the maximum loan limit per applicant is $20 million. The second thing is that the limit on the amount that can be used for the COSR will be 1/3 of the total loan amount. And then the third thing is that the department would set aside at least 20% of the funding for projects located in the rural areas. Section 110 of Article 1 is the application process. This section discusses the roles and responsibilities of the department as well as the applicants. The first thing that I would like to point out is that the department will issue a competitive NOFR for the NHTF funding, and the NOFR will include, among other things, the amount of project funds available, any restrictions on the uses of funds, general terms and conditions of funding applications, minimum requirements, time frame to submit the application requirements, and the rating and ranking criteria that the department will use to score each application. Also in the application process is the application requirement. The guidelines as well as the PowerPoint slide gives a list of all the information that a project or an applicant is required to provide when submitting an application. This is not a complete list. However, it points out some of the important information that a project or an applicant is required to provide when submitting the application. And then the third thing regarding the application process is that all applications must be made on the forms made available by the department. Upon receiving the application, the department will evaluate for compliance with the minimum requirements set forth in Section 102 and use the rating and ranking criteria outlined in Section 111, which I will discuss in a bit. For those applications that are requesting a COSR, the applicants must comply with the requirements in Section 108, which I discussed in a bit ago. What the department will do for each application is the department will score the application as submitted, even in cases if the application is missing relevant information, or the department will request additional information or supporting documents to clarify any unclear or ambiguous statements made in the application. Those applications that are selected for funding, they will be approved at amounts, terms, and conditions specified in the guidelines, and that will also be in the NOFR. The last thing that I would like to point out regarding the application process is that each application or project must achieve a minimum score in the following 3 categories in order to receive the funding award. The first one is development team experience, where a project is required to score a minimum of 18 points. The second one is supportive services plan, where a project is required to score a minimum of 5 points. And the third one is readiness to proceed, where a project is required to score a minimum of 20 points. And again, I will go into more detail regarding this in the application selection criteria. At this time, we will take any questions.
So the question is, will you be reviewing the underwriting standards during the webinar? It would be really helpful to review anything that's not standard. So we are not going to go into the underwriting standards. In the guidelines, as Abby mentioned, there is a section with all the reference to the underwriting standards. Most of it pertains to the UMRs. Okay, so we're going to move ahead to the next section.
Okay, Section 111 of Article 1 is application selection criteria. There are 8 categories in this rating and ranking criteria. The pie chart on the PowerPoint slide gives a breakdown of the major categories in the application selection criteria and maximum points awarded for each category. One thing I would like to point out from the slide is that development team experience and readiness to proceed, these 2 categories has the most points. For development team experience, an application can achieve a maximum of 35 points, and also for readiness to proceed, an application can achieve a maximum of 35 points. Before I discuss each scoring criteria in detail, I would like to point out that in the event of tied point scores, the following tiebreakers will be used to determine which project is selected for funding. They are readiness to proceed and supportive services plan. So the first scoring criteria for Article 1 is development team experience. A project can achieve a maximum of 35 points. And again, I would like to emphasize a project must achieve a minimum of 18 points from this criteria in order to receive the funding award. So for the development team experience, points will be awarded based on the experience of the project team, which includes the developer/ownership experience, property management experience, and lead service provider experience. In the PowerPoint slides, slide 46 and 47 gives a breakdown on how the points are awarded. For the developer experience, points will be awarded based on the number of affordable rental housing projects completed by the developer in the last 5 years, or supportive housing projects completed by the developer in the last 3 years. So 2 points will be awarded for each affordable rental housing project completed in a timely manner and within budget in the last 5 years, and or supportive housing projects completed in a timely manner and within the last within budget in the last 3 years. For the ownership/operations experience, points will be awarded based on an applicant's experience in owning or operating supportive or affordable housing projects. 2 things that I would like to point out regarding the owner's experience from the guidelines. The first thing is that owner's experience only includes experience of affiliated entities or principals, but it does not include the experience of board members. And the second thing is that if a project has multiple entities that makes up the ownership entity, points will only be awarded on the experience of the entity with the controlling interest in the ownership or has a continued role in the operation of the project. The second team member for development team experience is property manager experience. For this one, points will be awarded based on the designated property management agent's experience in managing affordable or supportive housing at the time of application. The slide gives a breakdown on how the points are awarded for the property manager experience, and also we have this information in the guidelines. One thing I would like to point out regarding the supportive property manager's experience for supportive housing, points will only be awarded for supportive housing projects that have been in operation for at least 2 years. The third team member for the project team is the lead service provider. For the lead service provider, a maximum of 15 points will be awarded for the LSP or the lead service provider's experience. The guidelines and the PowerPoint slide gives a breakdown on how the points are awarded based on the experience of the LSP in the last 5 years, providing comprehensive case management and or tenancy support to people experiencing homelessness. So points will be awarded for the LSP's experience in permanent supportive housing, number of years in permanent supportive housing, number of projects in permanent supportive housing, number of years serving the target population, experience in comprehensive case management, as well as experience of any partner agency or providing any documentation. And again, I would like to mention these information is in the guidelines as to how points are awarded for the LSP experience. The second scoring criteria for Article 1 is supportive housing. For this criteria, a maximum of 25 points will be awarded. The slide on slide 48 gives a breakdown on how the points are awarded based on the percentage of assisted units restricted as supportive housing. And again, maximum of 25 points will be awarded for supportive housing. The third scoring criteria for Article 1 is supportive services plan. A project can achieve a maximum of 20 points from this criteria. And again, a project must achieve a minimum of 5 points from this criteria in order to receive the funding award. The guidelines gives a breakdown on how the points are awarded, and the table in the PowerPoint presentation gives a breakdown on how the points are awarded based on the experience of the applicant in supportive services. Lizette will go into more detail on what a project is required to include in their supportive services plan, or what experience they need in order to receive points for the supportive services plan. At this time, we will take any questions we have regarding the application selection criteria.
So we have a question. Is there an opportunity to increase the number of points for supportive services offered? So we would welcome any comments, feedback during public comments. So if this is something, so go ahead and please send us your comments and your suggestions to our mailbox. Okay, since we have no other questions, we're going to move on to the next section.
Okay, the fourth scoring criteria for Article 1 is utilization of funds to offset requests. For this criteria, a project can achieve a maximum of 10 points. If you look at slide 51, the table gives a breakdown on how the points are awarded based on the other types of funds a project intends to use and to what percentage those funds equals to the NHTF funds. So say, for example, if the project plans to use 9% tax credit, and if that 9% tax credit equals to 250%, equals to 55% of the NHTF funds, then the project will receive 0.375 points. If the other fund equals to 100% of the NHTF funds, then the project will receive 3.75 points. And in order to receive full 10 points for this criteria, for those projects that use 9% tax credit, the 9% tax credit must equal to 250% of the NHTF funds in order to receive full 10 points for this criteria. Now, for those projects that plan to not use 9% tax credit, say for example, if they plan to use 4% tax credit, and if that 4% tax credit equals to 55% of the NHTF funds, then the project will receive 0.75 points for this criteria. If it equals to 100% of the NHTF funds, then the project will receive 7.5 points for this criteria. In order to receive full 10 points for those projects that plan to use 4% tax credit, it must equal to 150% of the NHTF funds in order to receive full 10 points from this criteria. So points will be awarded based on if a project intends to either use 9% tax credit or not use 9% tax credit. And again, a maximum of 10 points awarded for this criteria. The fifth scoring criteria for Article 1 is leverage of rental or operating subsidies. For this criteria, a maximum of 15 points will be awarded. Basically, points will be awarded based on the percentage of assisted unit a project has that are either already committed to housing choice vouchers, or if they already have assisted units that are restricted to rents not exceeding 30% of household income. And again, 1 point will be awarded for each 5% point increment, and a maximum of 15 points awarded for this criteria. The sixth scoring criteria for Article 1 is readiness to proceed. For this criteria, a project can achieve a maximum of 35 points. And again, a project must achieve a minimum of 20 points from this criteria in order to receive the funding award. The guidelines as well as the PowerPoint slide gives a breakdown on how the points are awarded for this criteria. Before I give a little bit more information on how the points are awarded, two things I would like to point out regarding the readiness to proceed criteria. The first one is that a project must have its supportive services plan fully implemented and supportive services available to the tenants at the time of occupancy. And then any application that can demonstrate that a particular category is not applicable to project readiness, then they will be awarded points for that category. So say, for example, if an applicant can provide documentation demonstrating that they don't have to comply with CEQA or any other environmental site assessment, then points will be awarded for that category. And then again, as I mentioned, the guidelines as well as the PowerPoint slide gives a breakdown on how the points are awarded. If a project can provide documentation that they have enforceable commitments for all construction financing, or they are in compliance with CEQA or any other environmental site assessment, or they have a documentation demonstrating title ownership, a fee title ownership, then points will be awarded based on that. And again, you can reference the guidelines to see how the points are awarded for the readiness to proceed criteria. The seventh scoring criteria for Article 1 is confirmation of local need. Maximum of 5 points awarded for this criteria. Basically, if a project can provide a letter from the local continuum of care describing how the project will serve the target population, or how the project will meet the homelessness need in the local community or jurisdiction, then points will be awarded for this criteria. The 8th scoring criteria for Article 1 is local efficiency and access to destinations, where a project can achieve a maximum of 5 points. The guidelines as well as the PowerPoint gives a breakdown on how the points are awarded. Points will be awarded for projects that are located within 1/3 of a mile from private or public transportation services, or 1 mile for rural areas, and or points will be awarded if a project is located within 1/2 a mile of existing and operational services. So again, 1 point will be awarded if a project is located within 1/3 of a mile from either public or private transportation services, and then points will be awarded if a project is located within 1/2 a mile of operational services, and the guideline gives a breakdown on how the points are awarded for that. So say, for example, if a project is located within 1/2 a mile from public, elementary, middle, or high school, then 1 point will be awarded. 1 point will be awarded for that. And then last thing that I would like to mention regarding the application selection criteria for Article 1 is that all applicants will be subject to the appeal process as detailed in the NOFA. At this time, we will take any questions that our listeners may have.
So the question is, will the selection criteria be the same for rural counties? So yes, it would be. Okay, so we're going to move on to the next section.
Good afternoon, this is Lisette Heiser, and I will be talking about supportive service section 112. Each applicant must include a project-specific supportive service plan. This plan is to be developed by a lead service provider and the property manager and shall include information listed in this section. Recipients must utilize a lead service provider. The supportive service plan must be described, the service to be made available to tenants in a manner that is voluntary, flexible, and individualized. Also, the following supportive services shall be made available to tenants based on tenant need. The following required services can be provided and easily accessible to tenants. For example, assistance accessing and linking tenants to Medi-Cal, case management, support in linking to Medicare, benefits counseling and advocacy, and basic housing retention skills. Furthermore, the following supportive services are not required to be made available but are encouraged to be part of the project supportive service plan. For example, services for persons with co-occurring mental and physical disabilities, recreation and social activities, educational service, and employment services, to name a few. Also, the following additional information shall be provided in the supportive service plan: description of the target population to be served, description of tenant outreach, engagement, and retention strategies, description of each service to be offered, how frequently each service will be offered or provided, depending on the nature of the services. For services provided off-site, the plan must describe what public or private transportation options will be available to tenants in order to provide them reasonable access to these services. In addition, the supportive service plan must have description of how the supportive service are culturally and linguistically competent, estimated itemized budget, description of how the supportive service staff and property managed staff will work together to prevent eviction, general service provider and property manager communication protocols, a description of how the physical design of the project fosters tenant engagement, on-site supportive service provisions, safety, and security, to name a few. Also, copies of draft written agreement or memoranda of understanding that identify the roles and responsibilities of the recipients, the project owner, other service providers, and the property manager must be provided. The department may request that any necessary updates to the supportive service plan or related documents be provided. Housing First. Projects shall comply with Housing First requirements as documented in the application, property managed plan, and supportive service plan. For the tenant selection portion, Section 114, tenants must meet income requirements in Section 105 and target population requirements in Section 102. Recipients shall accept referrals through the use of a coordinated entry system or other similar system in accordance with provisions and in compliance with Housing First requirements. For the rental agreement and grievance procedure, for rental or occupancy agreements and grievances procedures, as for assisted units shall comply with code standards. Tenants shall not be required to maintain sobriety, be tested for substances, or participate in services or treatment. For the section in vulnerable population best practices, the following best practice should be incorporated in the construction of projects that receive funding. Number one, general best practices for all developments must have safety features and property management. For those populations that have a history of sexual trauma and or domestic violence, once again, safety features and property management are required. Third, the property should have 24-hour security for projects serving persons impacted by domestic violence, transition-age youth, and other vulnerable populations. For the reporting requirements, recipients must collect and report data as described in the section of the Health and Safety Code to the Department at an annual and mid-year interval, no later than 90 days after the end of each project's fiscal year. For example, an independent audit, sources of tenant referrals, the number of participants living in the supportive housing project, the number of participants and the type of intervention offered through grant funds, the number of participants who exited the project each year and where they exited to. And finally, data on the impact of the program on participants. For the operating budget, the recipient shall submit proposed operating budgets to the department prior to occupancy and annually thereafter. The applicants must comply with federal and state overlays. And for the legal documents, the department and recipient shall enter into a state standard agreement. For the default and loan and or grant cancellation, the department may cancel loan commitments or COSR a grant under any of the following conditions. And I will go over a couple of these, and also this information is in our guidelines. The objectives and requirements of HHC cannot be met. Implementation of the project cannot be proceeded in a timely fashion in accordance with the approval plans and schedules, and special conditions have not been fulfilled within required time periods. And once again, this is in our guidelines.
So we're going to open up for questions. I'm going to give it a couple minutes. Okay, so it doesn't look like there's any questions, so we'll go ahead and move forward to Article 2.
Okay, so this is Abby again. I'm going to be discussing Article 2, which is funded by the Building, Homes, and Jobs Trust Fund. So it's a state-funded portion of the program, and you'll find it has less restrictive requirements, and it's a little bit more flexible than Article 1. So the minimum requirements, the eligible applicant for Article 2 is a county, and the way that this is defined in the guidelines is it can be a county, a city and county, or a city collaborating with a county, and you must comply with the requirements of the program and all applicable federal and state laws. You must also have an identified source of funding for the intensive services. And this can include one or more of the following. Some examples are county general funds, whole person care pilot program funds, program funds from the health home program, and other programs like that. You must also have a designated process for administering grant funds if you're not a county housing agency. And lastly, you must agree to collect and report data as described in the guidelines. For the application, your request for funding needs to promote housing for persons that meet all of the following requirements. First is they're chronically homeless or homeless and a high-cost health user. Second is they are a Medi-Cal beneficiary. Third, they are eligible for SSI. Fourth, they're eligible for services under the programs like the Whole Person Care Program, the Health Home Program, or any other locally controlled program in supportive housing. And lastly, they are likely to improve their health conditions with supportive housing. You must also show how your use of funds clearly aligns with the goals and strategies in the Health and Safety Code. Your amount requested cannot exceed the maximum amount specified in the guidelines. Again, your project needs to prove financial feasibility. And then you need to submit a resolution from the County Board of Supervisors or other controlling body authorizing you to apply for funding and use your other programs in the county as outlined, things like the Whole Person Care Pilot. And then lastly, any county subrecipient cannot be debarred or suspended from any state program. When it comes to the eligible uses for Article 2, they are a little bit more flexible. You can use it in any of the following ways. The first is acquisition and or new construction. You can also use it for reconstruction and rehabilitation of projects, operating assistance, and administrative costs. When it comes to operating assistance in particular, you can use it either of the following ways or both. You can use it for long-term rental subsidies to private landlords, or you can, again, use it as a COSR for an operating deficit for at least 15 years. You must ensure that your project complies with federal and state property standards, and again, those are listed in the guidelines. Just like in Article 1, there are occupancy and income requirements. Occupancy requirements are for the full term of the regulatory period again. And then household income cannot exceed the extremely low income limit or incomes at or below the poverty line, whichever is greater. When it comes to meeting the requirements of the target population to see if a tenant is eligible, again, this is the same as Article 1. You can document their enrollment in or eligibility for Medi-Cal. You can also document their status as chronically homeless. Some of those examples are entry and exits into homeless management information systems or an outreach worker or case manager's written observation. And again, these are in the guidelines. And then lastly, their status as a high-cost health user can be documented with similar examples that are also in the guidelines. There are rent limits. For Article 2, it states that it shall not exceed fair market rent. And again, this is determined by our department and published. And then just like in Article 1, if you have a tenant that's over income, it's considered a temporary non-compliance. So they can still reside in the assisted unit. You'll just have to cure that the next time you have a comparable vacancy become available to make sure that your mix of assisted units and non-assisted units remains the same. And we'll pause for any questions. I don't see any, so I'm just going to hand it over to Amaze, who will dive into more specifics in Article 2.
Thank you, Abigail. Moving on with Article 2. Section 207 of Article 2 is capitalized operating subsidy reserves. So for this article, the HHC grant funds can be used to pay for a COSR, provided the following conditions are met. The first one is that the COSR should have enough funds to cover any anticipated operating deficits related to the assisted unit for a minimum of 15 years. The second one, to determine the size of each project's COSR, the county will take the following factors into consideration. The first one is maximum percentage of assisted units the COSR will assist, the anticipated vacancy rates of a project, anticipated percentage of assisted units that will have other operating or rental subsidies, as well as the terms of the rental subsidies. And the last one is the anticipated income of the tenants that will occupy the assisted unit. In addition to that, the following standard assumptions will be taken into consideration for the purpose of establishing the total amount of COSR. There are 4 standard assumptions that will be taken into consideration. One thing I would like to highlight regarding this is again, for the stabilized residential vacancy rate. For the assisted unit, it will be assumed to be at 10% unless the use of a lower or higher rate is required by another funding source, such as TCAC. And then in the event if the department needs to modify these assumptions, the department will modify them as necessary to maintain the project's feasibility or extend the term of the operating reserves. And then the next condition is that in order to sustain the availability of COSR for a minimum of 15 years, the county may not disperse more than 5% of the total COSR award to a project per year, unless if it is determined that in any given year, if the operating deficit related to the assisted unit exceeds the projected amount, then the county can increase the disbursement to up to 7% of the total COSR. And the last thing regarding COSR for Article 2 is that the COSR can be used to pay for the following operating expenses. They are insurance, utilities, real property taxes, maintenance, and supportive services costs. Section 209 of Article 2 is maximum award limits. The maximum grant limit is $20 million, which can be used for new construction or rehabilitation of a project. And then Section 209 of Article 2 is fee limits. Basically what's in this section is that a county can use up to 10% of the grant to fund any administrative costs associated with the HHC program. Section 210 of Article 2 is the use of operating cash flow. Basically what's in this section is that a county is required to comply with the underwriting requirements commencing with Section 8314 of Title 25 for any uses of operating cash flow, such as capital or operating subsidies, which also includes COSR. And then the next thing that I would like to point out for Section 210 is that if there is any difference between the provisions of the UMR and these guidelines, then the provisions of these guidelines will prevail. At this time, we will take any questions regarding Article 2.
The first question is this funding coming straight to counties or is it competitive? So it is a competitive process, and depending on which article, it goes to the counties or for Article 2, and then for owners or developer for Article 1. Another question we have is there a set-aside for Article 2 for rural counties? As of right now, there is not a set-aside for rural counties for Article 2. Okay, so we're going to go ahead and move forward to the next section.
Section 211 of Article 2 is County Application Plan. Basically, a county is required to submit an application plan with the application package, and the plan must include the following. There are a list of things that the county is required to submit with the application plan. I will go ahead and highlight a few. The first one is that a county is required to provide documentation describing the homelessness population within county-wide, any special challenges or barriers that the county encounters in serving the target population, the resources that the county uses to address homelessness, and the system that the county has in place to collect any data that is required under the reporting requirements, which is in Section 219, which we will discuss later. And then again, This information is also in the guidelines, gives a list of everything that a county is required to submit in the application plan. Moving on to Section 212 of Article 2, which is the application process. So regarding the application process, again, the first thing is that the department will issue a NOFA that will detail the application process, which will have information such as the amount of funds available, application requirement, minimum requirements, and award requirements, the allocation of rating points, the deadline to submit the application, and the general terms and conditions of funding commitments. And again, upon receiving an application, the department will either evaluate for compliance with the minimum requirements as set forth in Section 202, and score each application using the rating and ranking criteria that is outlined in Section 213. Those applicants that do not meet the minimum requirements, they will be rejected and will not be rated. And then in scoring each application, the department will either score an application as submitted, even if the application is missing relevant information, or the department will request for additional information or supporting documents for the purpose of clarifying any unclear statements made in the application. And then those applications that are selected for funding, they will be approved at amounts, terms, and conditions as specified in the guidelines, and will also be in the NOFA. At this time, we will go ahead and take any questions regarding Article 2.
So there are no questions, so we'll just move ahead to the next section.
So Section 213 of Article 2 is the application selection criteria. There are 5 major categories in this criteria, in the selection criteria. The slide 98 gives a breakdown of the major categories and the maximum points awarded for each category. The first scoring criteria for Article 2 is the needs criteria, a maximum of 25 points awarded for this criteria. Basically, points will be awarded based on the number of individuals experiencing homelessness and the impact of housing costs in the county. The PowerPoint gives a breakdown on how the points are awarded. Points will be awarded, 10 points will be awarded if an applicant has more than 400 homeless individuals within the jurisdiction, or half the population in the applicant's jurisdiction pays more than 50% of their income towards rent. And the second part for the need criteria is the commitment to address the needs. Here, a maximum of 15 points will be awarded based on an applicant's commitment to address the needs of people experiencing homelessness. And again, the guidelines provide information or gives a breakdown on how the points are awarded based on the applicant's commitment to address the needs of people experiencing homelessness. The second scoring criteria for Article 2 is proposed uses and process for using funds. For this criteria, a maximum of 25 points is awarded. The slide, PowerPoint slide gives a breakdown on how the points are awarded based on the applicant's description of how they will use the funds, including if it is known at the time, if the applicant can provide information on how, where the project is going to be located or the completion date of the project. And then points are awarded based on how the applicant intends to use the grant funds, if they can provide documentation on that. And then the last thing regarding the proposed use and process for using funds criteria is that points will be awarded based on if the project or applicant can provide a documentation on the funding coordination of the funds. as well as if they can provide information on how the HHC funding will supplement any existing federal, state, or local funding. The third scoring criteria for Article 2 is the experience criteria. For this criteria, a maximum of 40 points is awarded for this criteria. The slide 101, the table on slide 101 and as well as 102 gives a breakdown on how the points are awarded. So as Abigail mentioned earlier when discussing Article 2, that the funds for Article 2 can be used for either funding, for either new construction or rehabilitation. For the experience criteria, points are awarded based on how a project intends to use the funding. If they intend to use the funding for either development or COSR, then points will be awarded accordingly. 15 points will be awarded if a project has administered either 4 or more supportive housing projects in the last 3 years. And then 10 points will be awarded if they have administered two or three projects, and 5 points if they have administered 1 project. Now, if the project or if the applicant intends to use the funding for rental assistance, then maximum of 15 points will be awarded if the applicant can provide information demonstrating that they have administered rental subsidies for at least 500 households in the last 3 years. And again, the PowerPoint slide as well as the guidelines gives a breakdown on how the points are awarded for 300 households and 100 households. The next thing regarding the experience criteria is that points will be awarded if an applicant can provide documentation demonstrating either development funding, rental assistance, or other operating assistance to the target population. And if they intend to use the funding for development or COSR, then 15 points will be awarded if an applicant has administered 4 or more projects in the last 3 years. And then the table gives a breakdown on how 10 points are awarded and 5 points will be awarded. Now, if the applicant intends to use the funding for rental assistance, then 15 points will be awarded if the project or applicant can provide information that they have administered at least rental subsidies for at least 500 clients in the last 3 years. And then again, it gives a breakdown on how 10 points or 5 points are awarded. And then the last 10 points for the experience criteria, 5 points will be awarded if an applicant can provide information demonstrating if they have encountered any barriers when implementing the homeless strategy or funding and how the applicant or project addressed those barriers. And 5 points if they can provide any best practices that they have developed that could be used by other program participants. At this time, we will go ahead and take any questions regarding Article 2.
So the question is, how many counties does HCD anticipate funding through Article 2? We don't know. I mean, I think because it's a competitive process, we will just have to wait until we receive application, and then we will rate and rank accordingly and competitively. Okay, so since there's no other questions, we're going to move forward to the next section.
So the fourth, for Article 2, the fourth scoring criteria is funding sources. For this criteria, a maximum of 30 points will be awarded. The table on slide 105 gives a breakdown on how the points will be awarded based on if a project can provide information demonstrating the methodology that they have used to ensure financial feasibility, and or points will be awarded if the project or applicant can provide information describing how they how they will provide ongoing funding for rental subsidies or capital or operating costs to sustain the program. And then again, for this one, a maximum of 30 points awarded for this criteria. And the guideline provides more information on how the points are awarded to applicants that can provide information on the methodology used to ensure financial feasibility. The fifth and the final scoring criteria for Article 2 is incentive points. For this criteria, a maximum of 20 points will be awarded. 10 points if the applicant has a whole person care pilot program or is working with managed care organizations to make health home program benefits available to people experiencing homelessness. And 10 points will be awarded if they can provide documentation demonstrating that they have locally committed funding program for projects that are at least equivalent to the amount requested for the HHC funding. And then again, again, all this information regarding the application selection criteria can be found in the guidelines as well as in the PowerPoint slides. The last thing that I would like to mention regarding the application selection criteria for Article 2 is that in the event of tied point scores, the following tiebreakers will be used to determine which project is selected for funding. The first one is the applicant's relevant experience. The second one is need. And the last one is the application plan that the county is required to submit. At this time, I will ask Lizette to discuss the supportive services for Article 2.
Hi, so I will be talking about supportive services. Article 1 and Article 2 are almost identical, so I will briefly go over the next couple of sections. Each applicant must include a county-specific supportive service plan that will identify how the county plans to provide or subcontract supportive services. The supportive service plan, once again, must be voluntary, flexible, and individualized. Using evidence-based models, the following supportive services shall be made available to tenants based on tenant need. The following required services can be provided and easily accessible to tenants. Housing navigation to assist people experiencing homelessness or to establish relationship with private landlords. Case management, support and linking to Medicare and dental care, benefits, advocacy, and housing retention skills. The following support services are not required to be made available, but are encouraged. Once again, they're very similar. Services for persons with co-occurring mental and physical disabilities, recreation and social activities, educational services, employment services. The following additional information shall be provided in the applicant's plan to provide supportive services. For services provided outside, the plan must describe what public or private transportation options will be available, tenants in order to provide them reasonable access to these services, description of how the supportive services staff and property management staff or landlords will work together to prevent evictions, proposed provider to client staff ratio. The department may request that any necessary updates to the plan to provide supportive services or related documents be provided, similar to Article 1. Housing first is the same requirements as Article 1. And for the tenant selection, tenants must meet income requirements, occupancy and income requirements, and target population requirements in Section 202. Recipients shall accept referrals through the coordinated entry system or other similar systems in accordance with the provisions and in compliance with Housing First requirements. For rental agreement and grievance procedures, rental or occupancy agreements and grievance and procedures for assisted units shall comply with codes, and tenants shall not be required to maintain sobriety, if tested for substances, or participate in services or treatment. The vulnerable population best practice is identical to Article 1. The following best practice should be incorporated in the construction of projects that receive funding from HHC as 1, general best practice of rural development, safety features, and property management. For number 2, once again, safety features and property management. And number 3 is identical to Article 1. For the reporting requirements, Section 219, the county shall, at an annual and mid-year interval, report all the following data to the department: no later than 90 days. The county shall submit the data as required by the department to measure the cost and outcomes for each assisted unit. The county shall report on the sources of tenant referrals for the projects and submit both client data and performance outcome data to the department. The number of participants who have received assistance to the program in the year and the type of intervention the participants receive with funds. The number of participants living in supportive housing or other permanent housing. To the extent available and feasible, the county shall provide data on the impact of the program or participants. And on to operating budget, the county shall submit proposed operating budgets to the department prior to award and annually thereafter. Federal and state overlays are similar to Article 1. And for the legal document, similar is comparable to Article 1 also. Defaults and grant cancellations, very similar in the event the department becomes aware of breach or violation by the grantee or its participant entities. Any of the provisions of HHC, SB2 requirements or standard agreements or the locally excited loan or grant pertaining to the project, the department may give written notice to violators. And if you have any questions, also you can forward your questions to our website.
Okay, so we're going to open it up for questions. Could a county apply for Article 2 funding for rental assistance and provide rental assistance to eligible renters and no place like home set-aside units?
Becky? No. A county cannot do that because that is stacking subsidies, and as we mentioned when discussing the minimum requirements, an applicant cannot use multiple HCD fundings on the same assisted unit.
So the next question we have is, under supportive services, is there a clear linkage to primary care services? So in our section, we did not specify that there has to be a clear linkage to primary care services. We did talk about certain types of linkages to medical services, but I don't think that there is a clear primary care services in our guidelines. So do we have any other questions? Okay, so thank you again for the opportunity to allow us to go ahead and present the draft guidelines. As we mentioned, public comment period ends December 8th, so we welcome any comments and suggestions to our mailbox. If you are not currently signed up on our listserv, please go to our HCD website and sign up. This will provide you with any recent or any updates to the programs that HCD offers. And again, this webinar will be posted to our website either end of this week or possibly next week. And then we will be sending out to all the participants a survey. If you would take a couple minutes and complete that and send it back to us, that will help us improve our future workshops and presentations. So thank you, everyone, for attending. So one more question. The question is, can you send the PowerPoint along with the surveys? The PowerPoint presentation is currently posted on our website, so feel free to go onto our website and right before you get to the workshops information, the PowerPoint link is right there. Okay, thank you, everyone.